Taylor Harris is a right-from-home, stay-at-home mom who lives in Charlottesville, Virginia, with her husband and 2 children. She studied creative nonfiction writing in graduate school, and her column, Big Mom on Campus, Raising 2 Kids in a College Dorm, won the 2012 McSweeney's Grand Prize.
Memories, like dreams, are patchwork creatures made of muted colors, smells, blurred landscapes, and drowned voices. I remember standing close to my mom in the far right aisle of a drugstore when the lights went dim to inform shoppers it was closing time. Panic has no name when you're 3 years old, but the walls of my brain collapsed into themselves with this thought: I will be stuck in this store with no way out. The same suffocating dread has since tackled me without notice, on planes, in math class, in large ice cream freezers, and even under streetlights of Madrid. It's the scene in the Indiana Jones flick where the ruins' walls begin to close in on Jones, but in my mind, he can't squirm his way out. If I were an artist, I'd paint the picture of that memory on a broad swath of canvas, call it Panic in Aisle 4. I would paint a round brown toddler with a forest green and fuchsia coat, turquoise Reebok sneakers, a mother's soft and feathered 80s hairstyle, a dimmed overhead light, and shelves filled with Jergens lotion and cotton balls. This is the stuff of fear, I would tell onlookers. If pain is weakness leaving the body, panic is weakness entering it. One clue that something was wrong I can't actually remember, but it's been told and retold to me, wallpapered to my mind and sanded over time until flush with my own memory. It has the makings of good evidence, of proof that I was not born alone, that fear was my fraternal twin. 5 weeks after my mom gave birth to me, she took a job working nights at the post office. She and my dad now had 3 children, a mortgage to pay, and a house filled with needy relatives who, God bless them, contributed more to the chaos than the mortgage. But within 2 weeks of mom working nights, I shut down, refusing to take a bottle. She tried all of the pediatric nurse's suggestions: flat 7-Up, popsicles, Pedialyte. By the time she reached the on-call doctor, I was screaming nonstop. "Is that the baby in the background?" the doctor asked. "Yes, that's what I've been telling you," Mom said. "Something's not right with her." "Well, my goodness, if that's her in the background, you need to get her to the ER. At 7 weeks old, I experienced my first admission to a hospital. After 2 days of IVs, Children's Hospital released me into the care of Dr. Dottie, my first and only pediatrician. He looked like Phil Donahue and always wore a toy monkey clipped to his stethoscope. Sitting on a black stool with one leg propped up on the other leg's knee, he'd listen and never rush away after writing a prescription. "What we're looking at here," he said that day, "is separation anxiety." In his view, I had not experienced enough bonding time with my mom, and maybe it had affected me more than the next baby. So there were clues that I had too much fear, a pathological amount. I never felt like it was something that wasn't going to go away, Mom has since told me. I thought it was more, temporary. Of course she did. Most of the time I was a silly, normal child who wore rainbow clown wigs and sunglasses or stuffed cotton balls in her ears just to get a laugh. My favorite photograph shows me at 3 wearing frizzy, braided pigtails, a necklace of dyed noodles, green Mickey Mouse sunglasses, and a fake Native American headdress. I'm brandishing a Barbie doll and smiling, my bare brown legs showing beneath a faded t-shirt that reads, "Happy Birthday." It'd be 13 more years until I earned my official diagnosis of generalized anxiety disorder. As a young child, when my fears did come, they wrapped themselves in blaring trains, cramped elevators, boogeymen, and butterflies. In one of my earliest memories, I sit straight up in Mom and Dad's waterbed in the middle of the night. Small creatures fly all around me, less than a foot from my face, my bent legs, my torso. They are too many to count, dark with tiny specks of neon color, not pretty or gentle like the monarchs. Taylor, what's wrong? Mom asks. She's always been the lightest sleeper. Butterflies, Mommy, butterflies, is all I can say. I can't rest until they leave me alone. My tiny hands pat at the comforter beneath me as I try to push them away. Somehow, between age 3 and 23, the butterflies transformed, endured an ugly metamorphosis. They became brain aneurysms, allergic reactions, plane crashes, and cardiac arrest, even eternal damnation. Each one served as an irrational thought that triggered a panic attack. Each one convinced me of imminent death. I was born in a field of butterflies, the kind that danced along my eyelashes and settled right under my lids, the kind whose wings parted the sun from my face, casting a long shadow across my temples. The same creatures, it seems, perched upon the nose of my mother, the ear of my grandmother, the finger of my granddad. I have hoped, much like every mother before me, that they will fly right past my own children.